The current recommendations for non-pharmacological intervention are cornerstone in weight loss techniques and weight loss strategies. There's no quick fix. There's no one magic pill that if you take it, you're going to lose weight. All of these agents, when any of the new agents are coming on the market for obesity measures and obesity management, it's meant to be combined with diet and lifestyle modification. And diet and lifestyle modification are the cornerstone for any non-pharmacological therapy. So the minimal amount of exercise is thought to be 150 minutes a week, which can be divided, 5 days, 30 minutes, or however that needs to be divided. If patients aren't doing that or not doing any exercise, to start at 150 minutes a week is a little unrealistic. So then it would be gradually working patients up to having daily activity. Start with 10 minutes a day, 10 minutes 3 days a week, and then gradually work up to that 150 minutes a day. 150 minutes per week. The other thing is weight loss. Now this is a big debatable fact. What diet do you choose? What's the best diet? Is there a great diet? And the answer is no. There's not one diet plan that's been proven to be better than any other diet plan. There's not one diet plan that kind of trumps all. It's really what is in line with the patient. And at the end of the day, we have to remember that this goes back to the patient, and we have to include the patient in a lot of these decisions. Because obesity was recently determined and classified as a disease, it is a disease, and we're here to be educating on disease state management. Pharmacists sometimes feel funny or sensitive about talking to patients about weight loss strategies and diets for weight loss strategies. There actually was a survey that was done to community pharmacists on how comfortable they felt on counseling patients on this topic, and if they felt they had the tools or resources to do so. And the overwhelming response from that survey was no. Pharmacists did not feel comfortable initiating conversations on obesity management or on weight loss techniques. They felt that it was sensitive information. They didn't want to put the patient at unease or hurt the patient's feelings. In addition, they also didn't feel that they had the knowledge or the tools to do so. So when it comes to picking diet plans, the ADA has a nice updated 2015 review, and they actually review different diet plans and diet styles, like the Mediterranean diet or the half-plate full method. The AACE, the American College of Clinical Endocrinologists, also have a really nice obesity algorithm, as well as the Bariatrics Society of Physicians. They have another great reference tool that pharmacists can go to. So for non-pharmacological management, diet plans and reviews of diet, there's not a one-size-fits-all for patients. And it's really assessing and talking with the patient and finding out what the patient is interested in starting and what their buy-in. Because if you don't have the patient buy-in for this non-pharmacological therapy, then it's not going to work. So it's really trying to find out what the patient's needs are, and then picking and educating on the diet plan that best meets their needs. What are the recommendations for herbal weight loss replacement? And this is paramount, because any pharmacist, and whether you work in hospital, whether you work in the community, whether you're a consultant, you're going to be asked about all the herbal supplements that are in the market and that are being televised and being championed by said reality shows or by said physician reality shows. So it's really important, because pharmacists get this question asked all the time, and it's important to know the answer. So there's a variety of different herbal supplements, and it depends on the herbal supplement as to has it been shown to be beneficial and has it not been shown to be beneficial, and kind of what the herbal supplement is, what's its mechanism thought to be, and is it successful. Overwhelmingly, there isn't strong evidence for any of the herbal supplements in weight loss, if I were to generalize as a group. The trials that have been done, if there have been trials, are very limited, are very small in size, and also very small in duration, not like the 56-week trials that we see with liraglutide. And that's really important for pharmacists to be aware of. And I'm not saying all the time, but a vast majority of the time when patients are asking about these herbal supplements, they're really looking for quick fixes. And it's really important that pharmacists can educate that there are no quick fixes, and that if some of these agents are being used, they're having less than the success of weight loss than with the prescription agents. So most of the prescription agents, as I said before, are going to give you an average of 5 to up to 10% total body weight loss from baseline. The agents that are on the herbal market, the herbal supplement, the most that anyone has even been able to show in the small studies have been 2.5%, up to maybe 5%. So less or similar to what's currently on the market. The other thing is, we don't know of the good manufacturing practices. Herbal supplements are not FDA regulated. There are companies that are strong manufacturers and have a good record behind them, whereas there are others that are not following those practices. So it's hard to say, and that's where pharmacists can really weigh in and provide some counseling and benefit to patients that are really looking at these agents.